Are rescue breaths necessary during CPR? Emergency care. This is printed in HSI.com. During a cardiac arrest emergency, immediate high-quality cardiopulmonary resuscitation, CPR, improves the chance of survival by providing oxygen-rich blood to the heart and brain. But what does high-quality CPR entail? Are chest compressions enough? Are rescue breaths necessary during CPR? These are the questions that are frequently asked and addressed in CPR classes across the country. Why is there confusion surrounding rescue breaths during CPR? When the 2010 American Heart Association guidelines for cardiopulmonary resuscitation and emergency cardiovascular care were released, one of the underlying goals was to eliminate barriers to action and increase bystander CPR rates by simplifying CPR for untrained bystanders. This involves supporting compression-only CPR, as it simply requires a few minutes to learn and can be easily communicated to the masses, resulting in more people taking action. However, the primary message that came from the news media was that rescue breaths were eliminated from CPR. Due to this overwhelming messaging, the goal of simplifying CPR for untrained rescuers via compression-only CPR inadvertently created further confusion on the importance of rescue breaths overall. Years later, public perception hasn't completely changed, as many people still question whether rescue breaths are necessary during CPR. To help clear up the confusion, here's how to understand and communicate the importance of rescue breaths to CPR students and the general public. For certified lay providers, rescue breaths are critical to performing CPR. CPR training for certification with an authorized instructor should always be taught with rescue breaths to increase the chance of survival. For the untrained lay provider, the option to perform compression-only CPR helps to eliminate hesitation or unwillingness to provide care. This also applies to cardiac arrest occurs for two primary reasons: sudden cardiac arrest, CSA, and secondary cardiac arrest. Sudden cardiac arrest, SCA, is the most common, which happens abruptly when the heart's electrical system causes the heart to stop pumping. Forward blood and oxygen flow ceases and normal breathing stops. However, uncirculated oxygen remains in the bloodstream. Research has shown that doing chest compressions without rescue breaths can effectively circulate the remaining oxygen in the first few minutes. Due to this research and other influencing factors, such as the risk of the victim vomiting and properly learning how to give rescue breaths, eliminating rescue breaths appeared to be a reasonable concept. But the other common path to cardiac arrest, known as secondary cardiac arrest, requires providing effective rescue breaths. Secondary cardiac arrest. Secondary cardiac arrest happens when an initial airway or breathing problem prevents oxygen from entering the body. This is the most common way cardiac arrest occurs in children, and it can be caused by medical emergencies like drowning, suffocation, or opioid overdose. With secondary cardiac arrest, the lack of available oxygen will progressively weaken and slow the heart rate down until the heart stops. Therefore, getting oxygen into the body becomes critical, as it will stimulate the heart to beat faster and become stronger. It will also trigger the resulting oxygen to reach the brain, which can stimulate breathing effort. We must teach traditional CPR with rescue breaths as the gold standard. However, we should also teach compression-only CPR as an alternative option for providing care. Why trained bystanders should perform conventional CPR. Conventional CPR is an emergency procedure that combines chest compressions with rescue breaths to circulate oxygenated blood to the heart and brain, increasing the possibility of successful resuscitation. High-quality chest compressions are the foundation of high-quality CPR, forcing blood to move from the chest to the lungs, heart, brain, and other vital organs. But rescue breathing, artificial ventilation of the lungs, is also a critical part of CPR, as it provides life-sustaining oxygen and ventilation directly to the person's lungs. To break it down further, rescue breaths provide both oxygenation of the blood and removal of carbon dioxide. This is done by using the bystander's own exhaled breath via a CPR mask or through direct mouth-to-mouth resuscitation, if willing and no PPE is available. But how effective is this exhaled breath? Room air contains about 21% oxygen, whereas exhaled air contains between 16 and 17% oxygen. Therefore, a bystander's exhaled breath provides enough oxygen to support life. In summary, trained CPR providers who are able should perform standard CPR with rescue breaths to improve the chance of survival. Compression-only CPR is, however, better than no CPR. The CPR steps are: place the heels of your hands on the center of the person's chest. Push fast and hard. Continue giving compressions until trained CPR or emergency medical services providers take over. The automated external defibrillator, AED, directs you to stop while analyzing, or the person shows signs of life. Example, responds by breathing, moving, or reacting. Compression-only CPR, once again. Call 911. Immediately call 911 to ensure help is on the way. Push hard. Place your hands in the center of the chest and start compressions. Push fast. Compress 100 to 120 times per minute. And don't stop until help arrives. CPR training saves lives. CPR training can make a significant difference in being ready and able to respond during an emergency, and it could save a person's life. Instructor-led CPR training provides students with the opportunity to practice high-quality chest compressions and give rescue breaths for adult, child, and infant scenarios. A CPR class may also address a variety of medical emergencies and first aid treatments that are often needed in the workplace, at home, in public places, and out in the community. HSI is a nationally approved and accredited training organization. They provide certification training that's led by authorized instructors. Learn more about CPR, AED, and first aid training for yourself and your organization with HSI. Interested in becoming a CPR instructor, or do you already have credentials with another nationally recognized organization will learn how you can train with HSI, CPR, AED, and first aid programs.